Yeah, hello friends. So this is what we have made, titanium cylinders with the extensions of the wings, and let's see how we can use it. Now this is where I have modified. I have cut one of the wings. So you can, decide on your length, width as well as thickness of these wings. So these are the two wings which I have already cut for my one of my demo video. Okay, so this is how we have fixed it. Now if you feel you can have a better positioning by changing, so you can do that also. Like if I feel that this might go to the posterior one, sorry. I think this will be a better one. Okay, so now these wings are joining each other. And what you can do, you can make your own framework. So this is a welder which we use. You can just hold it. And you can weld these wings. These are made up of titanium. So instead of ordering your normal regular titanium cylinders, if you use these ones, it can help in providing you with the metal framework kind of thing. So let's see if this, okay. Also, if you feel they are not touching each other, you can use these wires. You can weld these around it also. We can try this also. Sorry, I have to detach it because it has to be in this direction. And you can even join these to the wings also. For that you need a plier because there is a space. If you join this with this, you can have a better welding. Okay. So what you have done is you have made your own framework with the same titanium cylinders which you generally use to temporize a denture, or you give a PMMA. So I don't believe in only a denture temporization or a PMMA processes. It should always have a cross stabilization with the framework. So this is basically how it is better than your hybrid, because hybrid is made generally you do casting using cobalt chromium. So a cobalt chromium abutments, they touch the titanium of the multi unit. So here the advantage is that, so we have actually used a thick titanium wall. It's not similar to your temporary titanium cylinders. This is little wider, thicker. So you have a titanium to titanium touching. Then there is a framework which is made up using the same number of components. You have not purchased anything extra. Obviously here you have purchased this wire, but this wire does not cost much. And even if you are not using these wires, you can use the same wings or the extensions which we already have. Okay. And if you see, it's a very, very firm welding. There is no chance of any micro motion, which means when you will again when you will again fix your framework, it is going to fit very, very passively. That is the main advantage. So once I have tightened it, you can see that how beautifully it has sealed this area. And then you can cut this with the disc or your air rotor. You can do it in the patient's mouth, you can do it on the cast. I prefer to do it on the cast. We take an impression, we check the jig trial. If the jig trial is fitting perfectly, we can use the same. So it has fitted very passively. The number of turns which are required to tighten or unscrew remains the same. There is no activeness of any screws which is there. So if you see, it has come out. So it's a very passive framework which you will be creating for your temporizations. Thank you.